Hi, everyone, and thank you so much for the opportunity to present at the Canadian Neuroendocrine Tumor Society meeting this year. My name is Breffni Hannon, and I'm a palliative care physician at the Princess Margaret Cancer Centre here in Toronto. Today, I'm going to be speaking very briefly about palliative care generally, and also speaking about some pain management strategies that may be helpful to you as you go through your cancer journey. So I'm going to start by introducing the term early palliative care and outlining how it might benefit your care in particular. And in the second half of the presentation, I'm specifically going to explore some pain management strategies that we often utilize for patients with neuroendocrine tumors. So starting at the very beginning, I thought a good place to begin might be the World Health Organization definition of palliative care. While most people still associate palliative care with the very end of somebody's life, as you can see by the definition here on the screen, there is no mention of end-of-life care in this definition, and it really focuses on things like improving the quality of life of patients and their families when they're going through a life-threatening illness. And we aim to do this by preventing and relieving symptoms such as pain, physical, psychological, and spiritual distress, and helping people to live as well as they can for as long as they can. Although its origins were very much rooted in the end-of-life realm, over the past decade, there has been a real steady shift in getting palliative care teams involved quite early in the illness trajectory for somebody with cancer. And this shift has been very much based on the findings of several important research studies, including one that we did here at the Princess Margaret, which have demonstrated some important and very beneficial effects for patients with cancer. In all of those studies, over and over again, what the findings showed was that patients who received early palliative care alongside their usual oncology care, compared to patients who had oncology care alone, always showed better symptom control, were more satisfied with their care, were less likely to suffer from depression, were more likely to report better quality of life, and some even lived longer compared to patients who did not meet palliative care teams at all or who met them later in their illness journey. So on the back of those studies, what we've seen is a shift. On the top of this image, you'll see what we call the traditional model of palliative care, where patients with cancer would go through multiple lines of treatment with their oncologist, and when they finally came to the end of those treatment options, they would be handed over, so to speak, to the palliative care team to manage their symptoms and to take care of them in the last days, weeks, or months of their life. What we see now more than ever is a different model, as you can see on the bottom of this graphic, where palliative care teams get involved much earlier in the disease journey, and they travel alongside with the patient and their oncologist to help manage their symptoms and improve their quality of life throughout the journey. And on the back of those studies, in 2017, the American Society of Clinical Oncology, or ASCO as it's more commonly known, published a recommendation that said that patients with advanced cancer should receive dedicated palliative care services early in the disease course at the same time as their active oncology care. So that is where we're at currently in terms of early palliative care for patients with cancer. Now, still, the term palliative care can be frightening for patients when they hear it the very first time. And you'll see lots of these graphics throughout your care, or if you are referred to a palliative care team, to try and reassure you and to help you understand why the palliative care team is getting involved perhaps more early than you might have anticipated. What can palliative care do for me specifically is a question that patients often ask us when they come to see us in the clinic. And we asked that question of patients who participated in our study several years ago. Over and over, patients told us that the palliative care team complemented what their oncologist could do for them. And in particular, we found four main benefits. The first was around prompt, personalized symptom management. The second was around providing holistic support for patients and their families, recognizing the really important role that families play as patients go through cancer treatment. Patients and their families really appreciated having a second team to help guide them around complex decision-making. And patients who received early palliative care consistently reported that they and their families felt better prepared for the future and what that might bring as their illness progressed. We talk about a palliative care team, and that really is a team in the truest sense of the word. So in addition to doctors and nurses, members of the palliative care team will include social workers, counsellors, psychologists, spiritual care providers, physio and occupational therapists, pharmacists, and music and art therapists. And together, these groups of individuals each bring their own unique perspective and lens to your illness and help to create a really holistic and unique care plan for you and for your family. Moving on to talk about some pain management strategies. So one of the most common reasons for patients to be referred to the palliative care team is to help manage their pain or other symptoms. It's really important to point out that pain is not an inevitable consequence of your cancer, and that not everybody with advanced cancer will experience pain. So it's not something that you have to put up with or you have to endure. There are many different causes of pain in advanced cancer. Starting on the top left, the cancer itself can often cause pain or symptoms that are uncomfortable. The treatments that are prescribed for your cancer can be uncomfortable and painful. And sometimes the tests or investigations that we need to run to diagnose and to track your cancer can themselves be uncomfortable. We often prescribe medications that can be constipating, for example, and that's painful and uncomfortable and can contribute to how you're feeling overall. In addition to the physical side of cancer, cancer itself can cause anxiety, stress, and depression. And we know that suffering from those issues can really influence how your body processes and copes with pain and can make it seem worse. What we don't talk about so often in cancer are the social factors, things like worrying about your finances, worrying about your family and how they're coping and what your illness is doing to them, as well as wondering why this is happening to you when you've done all the right things and you've tried to live a good life and still you get sick with a diagnosis of cancer. Those thoughts, worries, and feelings can also contribute to your pain and make it difficult for people to process and manage their pain in a positive way. And finally, just because somebody has a diagnosis of cancer does not prevent them from having other medical conditions. Things like gallstones or kidney stones or infections, which can be really painful, can also happen as you're going through your cancer treatment and diagnosis, and those can be painful. What we now know more than ever is that the management of cancer pain is not just about taking pills, and that looking after everybody's physical and mental health is a really important component in managing cancer-related pain. More and more patients and their families are turning to things like meditation, aromatherapy, yoga or tai chi, massage, music therapy, acupuncture, and guided imagery as a really positive way of managing their mild or moderate pain and avoiding pain medications if that is their choice. Making these lifestyle changes can have a positive effect for your mind and your body. I have 2 patients who've recently taken up Tai Chi, and they've told me what a great experience it is, both for them physically, but also being part of a community and a larger group of individuals. It's also really hard, apparently. One of my colleagues is about to start a research study looking at using virtual reality for managing pain, using guided imagery to help patients manage and control their breathing and their pain when it's mild or moderate, or using it to distract themselves as they're waiting for their pain medications to kick in when their pain is more severe. Again, there's been a lot of research in recent years that has shown us that exercise is a really important component to your physical and mental health as you're going through cancer and cancer treatment. Even if you've never been a big exerciser in your life, it's never too late to start. And it's just fine to start slow and go at your own pace, doing things like stretching, walking, swimming, biking, or anything that feels comfortable for you. Small changes, small steps can make a really big difference. Patients will often ask us, well, what exercise can I do? What's safe to do? What's a good exercise to do? What won't make me feel worse? If you're not sure where to start, ask your team for advice. More and more cancer centers around the country are starting to engage with rehabilitation physicians, occupational therapists, physiotherapists. And here at the Princess Margaret, we have a dedicated team called the Cancer Rehabilitation and Survivorship Program, which is focused just on the exercise and well-being needs of patients with cancer and their families. Of course, if you're doing anything and it causes pain, you should always take a step back. But exercise is a really important tool in helping you feel well and stay strong throughout your treatments. Of course, there are going to be situations when we're going to prescribe or suggest medications to help manage your pain. This can range from over-the-counter medications like Tylenol or Advil to stronger medications such as opioids or narcotics such as morphine or hydromorphone, or nerve pain medications like gabapentin, pregabalin, or steroid medications such as prednisone or dexamethasone. There are lots of interventions. Those are things like injections, nerve blocks, or procedures that can be done or offered to help reduce your pain. And we sometimes use radiation treatments to shrink down tumors that might be causing direct pressure or pain in a particular part of your body, or that are pressing on nerves and causing nerve pain. Managing your pain really does involve a partnership between you and your team. The first thing that I can't reiterate enough is be honest. Like I said a few slides back, pain is not an inevitable consequence of cancer. It's really important that you report your symptoms to your team, either by filling out the questionnaires that you're asked to complete when you come to the clinic, or by just telling the nurse or the doctor in your clinic how you're feeling. If we don't know that you have pain, we can't help you feel better. And one of the things we know for sure is that identifying and managing your pain early will help us to keep it under control and have you feeling as well as possible for as long as possible. It can be really helpful to keep a journal or a log to track your symptoms. And this helps us to identify any patterns or triggers that there might be in your lifestyle, your medications, your treatment that are contributing to your pain and making it worse. This is also really helpful when you're taking pain medications. Keeping a log of how you're taking the medication, when you're taking it, how you feel afterwards, allows us to know whether the pain medication is working or not. Always please check with your doctor, your nurse, or your pharmacist before taking any medications, be those over-the-counter medications, natural or herbal remedies, medications that you have in your medicine cabinet from before, or medications that your friends and family might recommend to you for your pain based on their experiences. They might not be the right medications for you, they might interfere with your treatment, and your doctor, your nurse, your pharmacist will be best placed to give you the right advice. If your team has prescribed some medications for you, it's really important that you follow the instructions. Don't adjust or stop the pain medications without contacting your team and getting their advice. If your pain is not responding, if it's getting worse, or you have a new pain, again, don't wait. Let your team know. They really want to know so that you can be comfortable and you can feel well. If a medication has been prescribed for you and you don't like how it makes you feel, or you've got some side effects or concerns, please let your team know. The team is there to work with you to make sure that you feel comfortable and confident with the medications that you're taking, that they're the right medications for you, and if not, to help you make better choices about what would be the best medication to try next. Remember that support is always available. Your team really wants you to feel well and to do well, and part of that is managing your symptoms. In addition to the doctors and the nurses and the pharmacists in your clinic, remember that there are social workers, counselors, and psychiatrists always available if you need to talk to somebody about your problems or your concerns. Just as with CNETs, there are so many peer support groups available that can help you to engage with patients just like you who are going through the same experiences, the same symptoms, and that can be really helpful. And don't forget that a referral to the palliative care team might be the right thing for you, and don't be afraid about asking your team to help you to make that referral. I want to thank you so much for the opportunity to speak today. Before I finish, I want to pay tribute to a really important member of the CNETs community and somebody who's also really important to me. Lynn Gates has been a strong vocal advocate for the CNETs community for many years now, and I know that she would ordinarily be at this conference and being a very vibrant part of it, but unfortunately is not able to join us this year. Lynn first came to my clinic 5 years ago, and over the past several years, she has become such a strong advocate for early palliative care. She's introduced me to the CNETs community, and I hope that together we can continue the great work that she has laid the groundwork for in improving collaborations between CNETs and the palliative care community moving forward. Thank you again for the opportunity to speak today, and I hope you all enjoy the rest of the conference. Thank you.